This is Patrice Wendling reporting for Elsevier Global Medical News at the annual meeting of the Radiological Society of North America with Dr. Timothy Roberts, and he is associated with the Children's Hospital of Philadelphia. Autistic children do have problems in communication and language.
And it seems very likely that a difficulty in processing rapid auditory sounds and speech may lead to downstream difficulties in forming a language representation.
Your group used MEG studies to evaluate auditory processing. Why is this imaging modality useful for this kind of study?
So MEG is a unique technology that allows us to look at brain activity or brain function with both a spatial viewpoint and also importantly a temporal viewpoint. That is, we can ask the question not just where in the brain is function happening, but when is it happening.
How might this information be used in treatment planning for children with autism?
So we know that the autism spectrum is very broad. Different children have very different manifestations. And we're thinking that by asking the brain for signatures of autism, such as auditory processing deficits, as we saw here, that we may be able to subtype into categories of autism that show greater or lesser neural deficits.
What needs to be done next? What future steps in order for auditory testing to become part of a workup for autism, for this to actually come into practice?
Well, there are a number of steps that we take when developing a technology and taking it from late-stage research through clinical translation into clinical studies. I think, of course, this data should be replicated by other groups, and I think we should also see what its predictive value is by seeing if we can scan children at a younger age to see if it has a role as a predictive marker.